Another interesting discussion. As we know, healthcare systems around the world are constantly searching for ways to improve outcomes while making the most of existing resources. But what if one of the most powerful solutions has been in front of us all along? Our upcoming session will explore the role of patient empowerment within the healthcare ecosystem when patients take an active role in their own well being through daily wellness practices. It can lead to stronger healthcare outcomes and more sustainable systems. Please join me in welcoming Heather Van Wolf, Chair at Institute of Energetic Medicine, who will guide us through this insightful session titled Patient Empowerment as the Missing Link in Healthcare ROI. We look forward to hearing her perspectives on how empowering patients can help shape a more effective and sustainable future for healthcare. Let's give him a warm round of applause. Come on up. Good morning.
Hello there. Thank you so much. I appreciate you. Hello, good morning. I am Dr. Heather Wolf, and I'm here this morning really thanking Health 2.0 for making this opportunity available. I want to welcome you all. Good morning. I wanted to do a presentation about patient empowerment. What does that mean? I think it's the missing link in improving this kind of disastrous situation we have in healthcare. As you know, rising healthcare costs are crippling our ability to be a profitable nation. If you look at gross domestic product, our healthcare is kind of draining it. We have all these advancements. Why aren't we having a great profitability? What happened? What I'd like to present to you is the fact that I think the missing link is so simple, it's staring us in the face. Patient empowerment. That wonderful panel that we just listened to, all talking about these very simple, little, very effective ways to empower the patient with these simple abilities to orient to the state, to come up here on a stage. Right now, I'm very nervous, but I did something in energetic medicine in Hawaiian. It's called ground, breathe, hakalau. What the heck does that mean? It means that I ground into this moment. I breathe, and I'm able to calm my nerves and finally present to you what I really, it's my mission in life. Empowerment. So hopefully this thing is going to work. Look at my face-tuned picture. Isn't that pretty? So I'm Dr. Heather Wolf, chair of the Institute of Energetic Medicine, founder of Cure CRPS Foundation. Yes, I tried to find a cure for complex regional pain syndrome. Spokesman of the Coalition for Terminally Ill, Disabled Elderly, and I'm also Harvard Medical School Global Healthcare Leadership Program. Professor of Doctor of Chinese Energetic Medicine residency program with my colleague, Dr. Christopher Holder here. But most importantly, why am I on stage? Because I was the high-cost patient. I was the lost cause. So I'm going to show you some disgusting pictures of what it looked like inside my neck after I broke my neck in a kickboxing accident. Check it out. Traumatic cervical injury C5 vertebrae. I want you to look at the right. Do you see this? This is what happens when you think you're good at kickboxing, but you're not really good at kickboxing. So they said, one is fun, run, and I'm running around and I fall on my face. I didn't know my neck was broken, so it would be called what we call an occult injury. I then rode my horse. Then my neck got broken worse. Then I finally went to the chiropractor who gave me an adjustment. And the next thing you know, I was in the hospital getting an MRI where they said, oh my God, get yourself to a neurosurgeon. So what happened in 2011 was a sea change. I was a competing equestrian and I was a a person on Wall Street. I was very successful. I had everything going for me. I was feeling really good as an athlete, and then boom, I break my neck. And then what happens is I say, okay, I was fortunate to be able to have leading healthcare, like wonderful world-class healthcare. So breaking my neck followed two major reconstructive surgeries, the first of which didn't go so well. If you look at the list of all the things I was diagnosed with, 13 years of chronic pain ensued, occipital neuralgia, that feels like a cattle prod is in your brain electrocuting your eyeball. Reflex sympathetic dystrophy, this is when the pain system is upregulated. So every moment you feel like you're on fire and burning to death, or you feel like you're being electrocuted from the inside out. And let me tell you, we as doctors have no idea how bad it actually is to be a patient. So when I have a patient coming to me complaining of pain, it can be so bad you have no clue unless you've been there. So we talk about all the interventions. I'm like a poster child of interventions. So check it out. I also was very excited to do a lot of leading treatments. Complete laminectomy, C4 to 7 in the back of my neck. They took out the spinal process here. That didn't work. It destabilized the spine. So then they went and took these bones and they basically carved them out and created a cage and went through the front 1 year later, because from my elbows down was atrophy and from my knees down was atrophying. They said it was causalgia. 38 rounds of Botox. I am in love with Botox, not because it makes my forehead look like a younger lady, but because they would give me shots in my occipitals and all up and down my back to get the dystonia from letting go of my spinal cord, because I also developed tethered cord syndrome. I don't mean to gross you out with this, but check out the cool bicycle parts in my neck. I met the inventor of this at Harvard Medical School Global Healthcare Leadership Program, and he said, I feel so bad that you had chronic pain after we installed that hardware. I said, you did a great job. The stem cell experiment in my neck turned cancerous. There's no way to take out stem cells from other people that create graft versus host disease. So when I got the form letter from the FDA saying, the experiment that you took part in has led to a wrongful death lawsuit for 42,000 people, and we're sorry, here's $1.3 million. I said, no, I don't need your money. I would like to live, please. Like, I'm not ready to go. I was going to find a solution. So even though I had pain, I had all this, look at all this evidence of give up, right? They take my bones out. I could push on the back of my neck and feel my spinal cord. So I did all of these things. And if you look at the very bottom of intervention, it ends with Chinese energetic medicine. That's what this guy's a professor in. This man that's my guest. He helped me find the way to get from a patient that spent most of her day in bed. I had to choose what one activity I could do because the pain was so blinding. It literally blinded me. When interventions fail, even with this excellent care I was getting, by the way, I'm fairly well off. I used to be with the JP Morgan. I created the global enterprise management system for them. I was an engineer before I broke my neck. And so I had the best doctors. I literally had concierge doctors. I could see anyone I wanted. And I believed in all this medicine. But this failed, that failed. How can I actively participate in my own recovery is what happens after 13 years of failed interventions. Every intervention, I was like, this is going to be the silver bullet. I'm going to get better. Until I wasn't, right? 13 years, what do they say? If you keep doing the same thing over and over. Exactly. So what is the patient's role in determining their own outcome? This is what I was asking myself, because I'm like, okay, what am I doing wrong? There must be something I can do differently. I still was trying to ride my horses and my zebra donkeys. Yes, I own zebra donkeys. Okay, necessity is the mother of invention, is what Plato said. So God bless Plato. Patient seeks a cure, right? I created the Cure CRPS Foundation because I was living with this horrendous pain, and I thought, let me make some use of this experience in my life. I also created the Coalition for Terminally Ill Disabled Elderly because patient management systems are profiling patients as drug addicts that complain of pain. And a lot of times they are addicted to pain management, like the patient that was mentioned, the young person that was born with a spinal cord injury. The intervention, the gold standard, is to go on OxyContin. Do you know what that does to your motivation centers? It's not good. I took myself off of all of the things. I had 17 medicines I was on to try to manage spasticity, dystonia, pain, more pain, sleep disturbance, motility issues of my gut. So I was on all of the medicines, and finally I said, you know what? I just want to see what this body feels like without all this stuff. The Coalition of the Terminally Ill, Disabled, and Elderly now has 36 chapters across the United States because apparently I know how to advocate. The Cure CRPS Foundation, a lot of people don't know what complex regional pain syndrome is. It has like 12 different names depending on who you're talking to. I finally decided I would go after the science because the doctors, the specialists didn't know how to help me. And I could see the doctors that would be sitting in my face saying, I want to help you, but there's really nothing we can do. There's nothing we can do anymore. So I decided, okay, I'm going to go back and I'm going to search that science myself. That's what I learned when I was working at JP Morgan and when I was reverse engineering systems and software and building new application servers for the financial industry. I was always deep diving stuff, and I said, let's go back to school and might as well go to Harvard, because if you're going to go to school, go to a good one, right? Go to the primary source and find out who's doing the best. Then my Harvard immunology professor, she was the one that said, you know what? Go east. Because I was asking for her, how do I stop these cells from growing? So forget about the pain. Forget about the broken neck and the spinal cord issues. Forget about not being able to feel my feet or hands. I was getting tumors. They were growing all through my body. And so that was a game stopper. I had a giant tumor on my jugular vein. And so that thing, nobody wanted to operate on it except for Dr. Weed. Dr. Weed is at Miami Medical Center, and he's in the head and neck cancer unit. And he was amazing. Actually, love this guy. He was one of the few that was able to say, okay, I'm going to try that. But my Harvard immunology professor said, fix your gut if you have cancer. The gut microbiome. And then she said, go east, because there are other ways to heal a human being. And they have to do with what Osher's school at Harvard Medical School is practicing, mind-body practice. And I thought, hey man, if this woman that's published 150 studies in cancer is saying that, hey, maybe there's something to this mind-body medicine, I'm going to try it. And that is when I decided to also pursue a Chinese energetic medicine doctorate with the world's most famous English-speaking doctor of Chinese medicine, also known as medical Qigong. A lot of people don't know how to spell it, they don't know how to pronounce it. From there, I left my neuroscience PhD program because I'd rather save my life than get a PhD in neuroscience. And that's what I did. Thank you, Dr. Holder, for helping me. He was actually my clinician. And after I healed, what? She healed? How? I came back to Harvard, and they took me back. How nice of them. Harvard Medical School, global healthcare leader, Yes, on the 15th of May, I'm giving a lecture about how to integrate this medicine into the global healthcare marketplace. So, what is it known when you heal yourself, when you're fully healed? It's called full functional recovery. That's how Western medical uh, science basically describes what happened to me. No evidence of disease. How awesome is that? Complete remission of chronic pain. Guys, I went from a level 10 where the neuralgia, electric cattle prod in the brain, it felt exactly like that. And now I stop it with something called teacups. Return to optimal functional mobility. Guess what? Yes, I like to go surfing, mountain climbing, and I'm about to climb Mount Kailash in Tibet. The science behind success is learning autonomic regulation techniques, which is what we've all been talking about, mindful meditation, movement and breathing, and conscious, continuous state regulation of the human being. That's it. That's all I had to do, literally, to stop the most heinous chronic pain known to mankind. They call it a suicide disease, two of the chronic pain conditions that I had. And this is it. Look at this. And if you see this little picture, it says fascial interstitial. NYU just discovered the system that Chinese energetic medicine knew about for 5,000 years, and that's the interstitium. This is the liquid material that all of your tissues are kind of bathed in, collagen fibers that reorganize and regulate and change shape according to your conscious state, your state of emotional awareness. So in the Harvard Global Healthcare Program, we're asking, where is the primary site of care of healthcare? We were moving from a hospital system to outpatient centers for big surgeries, and now it's all about home health care. But what I'm saying is, let's take it one step further. It's within the patient. Within the patient. And what is energetic medicine? A lot of people don't know what it's called. It keeps getting a rebrand. What I came to it as was medical qigong, Qigong, but we now call it energetic medicine, Chinese energetic medicine, neurocognitive affective regulation training. That's what psychiatry calls it. And don't forget, there are silos of science where silence is between the silos. This guy isn't talking to that guy. The value-based care systems aren't talking to the behavioral and psychophysiological interventions that psychiatry knows about. So how do we get all these people talking to each other and speaking the same language? Let's call it the easiest, most simple thing, can we? Energy medicine. Here's the foundational concept, super simple. Breathing hygiene. How are you breathing? How am I breathing right now? I can talk. Can you tell? I teach Qigong every morning, no matter what, for 1 hour at 7 a.m. California time, wherever I am in the world. I just taught downstairs where there was a woman twerking to Rachmaninoff. So I teach wherever I go. How do you do your breathing hygiene? How are you breathing? Because if you're breathing deep like a little baby that was just born, it's very calming. Your autonomic system shifts into parasympathetic mode. Emotional regulation. You see here, I have the Institute of Energetic Medicine Scream, Dream, and Become journals, the 3 journals that help a person understand how to regulate their own emotional state. The other foundational concepts are how to orient to pain in a healthy way so that as these wonderful panel of people were talking, all the doctors were speaking about, hey, some pain isn't bad. Discomfort, we train that in medical Qigong. In Chinese energetic medicine, it's all about managing the emotional state. And from there, once you're there, when you master your state of consciousness, then you can initiate movement from a place of calm, from a place of relaxation, where you can master that relaxation technique. So daily movement practice is the heart and soul of how we help humanity. Get up every day, tell yourself you're going to do your practice where you pull down the heavens and you relax, release, and allow yourself to be you, to connect with the heart and soul of your own self. This is what you get out of it, improved balance. Now, I'm about to fly through a bunch of slides. Don't believe me. I'm the nerd that loves to stay up late at night and read legislation, and I like to read science studies. Am I a nerd or what? National Institute of Health, Journal of Science, National Academies of Science. I just went and met with the head of the National Academies of Science, and I talked all about this. New England Journal of Medicine. This is where all the science sits, but it's in all different little tranches, little specialties. My job is to bring it all together. Autonomic regulation. I put together this slide presentation. I'm going to put it on my website. All of you, I encourage you to download it so you can become familiar with the studies. Chronic pain reduction. Don't believe me, but please do believe me, because my experience of living through pain, I wish it was having a reason, right? Journal of Pain, Journal of Psychiatric Research, the World Health Organization, stress and anxiety, depression. I don't have any more of that. Immune function, inflammation. Of course, your autonomic system is all about being reawakened. So we have cognitive function, neuroplasticity. Now I'm about to lead you through experiencing the intervention. It's very simple. Inhale, imagine bright white light. Raise your hands up. Ah. More white light, and imagine that anxiety and grief and sadness are coming out on your out breath. Ah. And all your skanky chi is leaving your body. That is the professional way that I call all that crap that makes you sad, depressed, anxiety-ridden. Opportunity knocks, you guys. Check it out. This is what I've produced for Harvard Medical School. Employee wellness. That's how I'm infiltrating the insurance industry. I'm introducing it to high-level executives. They have the experience and say, guess what? This stuff works. It's so cheap. Patient recovery, preventative care. Increasing value per healthcare dollar. You can check this out looking at the science. This is the economic science, the ROI. Yes, I did my homework because I'm a power nerd. And this is what happens when you go to Harvard. The future of healthcare, authentic automation, and AI. I actually love AI. It's my boyfriend. The next breakthrough in healthcare is not something we prescribe, it's something we teach. The doctor is going to become more of a professor now. We're going to teach the patient, hey, you've got this thing called an ascension vehicle. It is a beautiful way for you to experience your life and get the most out of it. And number one is fun. This is what I teach. I would invite you now to come. See, I'm teaching at Harvard Medical School, Qigong. And Dr. Holder and I are about to present at the Osher School how to treat neurodegenerative illness, TBI, and stroke with Chinese energetic medicine. So no joke, guys. This is helping people with the worst problems you can imagine. And I have my link to my daily class. It's free every day. Come and join me. And there you are. Thank you so much for listening. I appreciate you.